We would now ask unanimous consent that our distinguished colleague from Minnesota, the gentlelady Representative Bachmann, be allowed to participate in today's hearing for both the purpose of questions and an opening statement. And without objection, so ordered. I now yield to the gentlelady for her opening statement.
Chairman Platts and Ranking Member Towns, I thank you so much for your consideration and graciousness allowing me to be able to testify briefly before this committee today on this critical program. And I thank you also for the bipartisan way in which this committee is moving forward on this subject, as we are on the cusp of a major expansion in Medicaid in the United States. It's more important than ever, and I commend this committee for taking up this important issue of vouchsafing the expenditure of the people's money, and I thank you for that. In April, I testified in a joint hearing of 2 Oversight Committee subcommittees on the complete lack of reporting, collection, and verification of meaningful data in Medicaid. I underscore what I just said. That's a breathtaking statement. There is a complete lack of reporting, collection, and verification of meaningful data in Medicaid. The same is not true for Medicare. That's why this is a bipartisan issue, and one that we hope will focus on helping the needs of the poorest among us in the United States who must have these program monies in order to survive. The staff report from that hearing stated, quote, "Minnesota provides a stunning example of how states are failing to properly ensure the appropriate use of taxpayer dollars spent on Medicaid managed care. This is something we are not proud of. In order for states to ensure the appropriate use of taxpayer dollars, they must be able and willing to collect the data that shows how much is paid in a claim, for what, and to whom." That's only basic common decency. Since the investigation into Minnesota Medicaid fraud has unfolded, several implicated parties have begun to offer up excuses. According to the Trade Organization for Managed Care Organizations, the Department of Human Services actually has the data but not the ability to analyze it. They say the state's computer system is too antiquated. But in contradiction to this, a DHS Assistant Commissioner said the data is, quote, "literally analyzed by DHS on a daily basis and has been for years." So now either the trade association representing the health plans is fudging or DHS is. We need to find out who. It's our job to immediately get to the bottom of this, and I thank the committee for what you are doing. CMS is already tasked with identifying patterns or instances of fraud and abuse in Medicare and Medicaid. That much we know, and that much is good. But despite that, they require no documented data. Now, the two don't go together. You can't do your job if you don't have documented data. That is why this month I am introducing a bill that will hold CMS accountable to ensure stated audits are conducted properly. That's why this is totally bipartisan, a bipartisan bill. We just want to know where the people's money is going, and is it going to help the poor people in this country who need these services. But because this situation needs immediate attention, I am proud to announce that I am sending a letter today to CMS calling for an immediate third-party independent audit of Minnesota's books. We can't allow taxpayer dollars to flow without proper record-keeping ever again. Thank you again to the committee for your fine work, Ranking Member Towns, and also for your fine work, Chairman Platts. I am thrilled to be a partner with you in this important work that you are doing, and I yield back.
Thank the gentlelady for her opening statement and her involvement and interest in the issue, as well as your focus on the efforts in Minnesota specifically in seeking to make sure we do right by all of our taxpayers in Minnesota and across this great nation.